Hello, my name is Jennifer Shirolis, and I'm a registered nurse and a certified diabetes educator, and I work at Barnstable Brown Diabetes Center in the outpatient department. I do the diabetes education for services for pediatrics as well as adults and pregnant ladies. So I have the advantage of being able to work with all different age groups. My job consists of working with patients of all different levels of having diabetes or gestational diabetes. So some ladies will have a problem with their blood sugars while they're pregnant, and I'll work with them for the duration of their pregnancy. I also will see pediatric patients. Sometimes they're newly diagnosed. Sometimes they are learning a device, continuous glucose sensor, also insulin pump instructions. I do those for pediatrics as well as for the adult population. I also work with patients in a DPP program, which is the Diabetes Prevention Program. And these are individuals who have not met the criteria of having diabetes, but they are at risk for developing diabetes. And so they participate in a year-long program, and we meet several weeks throughout that year. And we work on healthy lifestyle of exercise and also things to eat to improve their life and hopefully prevent diabetes. My mother was a nurse, and so that's what I had spent my life knowing is, hospital information and nursing things. And then I had the opportunity many years ago to work in diabetes education. And I was told that give it a chance and see if you like it. Well, we've been 29 years and I still like it, so I enjoy working with patients and helping them. At the University of Kentucky, we have the advantages or benefits of being able to work with multiple disciplines. We're able to have dietitians and nurses that collaborate together as long as they're with their physician or their nurse practitioner or their physician assistant. We also have the opportunity to teach students. So they come in and learn from us, learn what we're doing. I also participate in employee education as far as training new employees. I know that most patients, when they come in for education, they have all kinds of emotions. They may be afraid, they may have experienced a family member who had diabetes, or neighbors who may talk about how they should take care of themselves, which may or may not be true. So I try to be at ease and work with them where they are, ask them questions, how they feel about having the diagnosis, what concerns they have, and what they're wanting to get from the session. The thing I like the most about my job is working with the patients. Sometimes they come in scared, but they feel a little bit more relaxed after they've learned information that they maybe have control of things. And then I have the advantage of calling them back after a few weeks to see how they're doing. And it's always wonderful to hear from the patient of what they've changed, whether it be large or small, but they've made changes. And when they tell me they feel better or they're glad they came, I always appreciate that.